So often in our clinic, we see patients coming with complaints of diabetes and diabetes affecting the eyes. And often patients are confused whether they should be seeing the eye specialist or not, or when they should be seeing the eye specialist. Now, this is a grave concern, and I want to address it right away. So, first of all, the most important thing is that you have to come for a diabetic checkup as soon as you're diagnosed with diabetes. Okay. See, type 1 and type 2 diabetes होता है. Type 2 जो है, that is very common. So type 2 diabetics, as soon as you are diagnosed with diabetes, to come to the eye specialist for a checkup. Now, why do you need this checkup? Because diabetes can affect any part of your eye. ठीक है, starting from the ocular surface, you may be having simple dry eyes, or the dry eye may be related to diabetes. Then from the lens, it presents as a cataract. And then from retina point of view, there may be changes in the retina. And depending upon the severity of changes in the retina, the eye specialist is going to call you on 6 monthly interval or 3 monthly intervals. Now, what do eye specialists do if you have diabetic retinopathy, or say cataract, or say dry eye? See, the treatment for dry eye is very simple. They'll put you on some eye drops. If there is a diabetic cataract, that means there's a cataract inside your eye, the eye specialist is going to operate on the cataract and put in the lens. Now, for diabetic retinopathy, most of the queries are for diabetic retinopathy. Now, in diabetic retinopathy, the patient and the doctor have to work together for a long time, because the diabetic retinopathy, if it is involving the macula, means that your vision is getting blurred. The doctor will tell you for some intravitreal injections. Intravitreal injections are what? They are injections given inside the eye by the eye surgeon. Now, why do we need to give these injections? Now, these injections are to reduce the edema in your retina. Now, many patients say that I cannot afford the injection. Why can't we leave it like this? No, we cannot leave it like this. Then there's a high chance that your vision will deteriorate further. So we cannot leave it like that. Yes, if you have a good diabetic control, your vision may improve, but if your vision is not improving despite a good diabetic control, you may require intravitreal injections. Intravitreal injections, I mean injections inside your eye, which the eye surgeon will give you. Now, many queries, patients are full of questions for intravitreal injections because there are too many injections coming inside the market. But the thing is that these intravitreal injections are 100% important, and 100% they are going to reduce the edema. Now we have got biosimilars in the market for intravitreal injections, which are cheaper and they are doing a good job. So if you cannot afford a 15,000 injection, we are giving you a 5,000 or a 6,000 or a 7,000 or a 8,000 injection. Yeah, sometimes these injections of ranibizumab, which is the salt that we give intravitreally. Now, if the effect is not there for a long time, we may switch on to expensive drugs also. Expensive drugs, I mean expensive intravitreal injections also. Then again, you leave it to the doctor to understand when this injection is required.